Okay. Again, good afternoon, and I would like to start with a little, starting from, I will start from the first TMS EEG paper ever published in scientific literature, and it's a paper by the group of Krakow, Amassian, and Maccabi from the State University of New York. Here, these neurophysiologists were able to record the first, for the first time, TMS evoked potential that you can see here. But what I would like to highlight from this paper is this little paragraph from the method section. They say, during delivery of stimuli, the magnetic coil was progressively tilted towards the horizontal until a response was elicited and then carefully rotated to yield minimal stimulation artifact. Additional stimuli were then delivered at surrounding sites at approximately 1 centimeter intervals until an optimal response was recorded from contralateral homologous scalp. How we can translate this little piece of the method section for the questions we were coming out during this symposium? I would translate this in the following way. The neurophysiologists from the New York State University were looking for the EEG response to TMS. So where they were actually minimizing the artifacts due to TMS, and meanwhile they were maximizing the impact of the TMS on the cortex. So how can we do that? First, we have to use, and this was not the case for the paper from Krakow et al., we have to use a TMS-compatible amplifier. Otherwise, as already introduced by Risto, we will have a long window where the amplifiers are saturated by the strong TMS pulse delivered on the EEG electrodes. I will go fast here. Risto was using, and Virtanen were using two little stages in the amplification circuits. These stages are two sample and hold circuits which unplug the amplifiers before the stimulus, and they are plugged again right after the stimulus. I will call this kind of amplifier a next-stim lines-like system because, up to my knowledge, it was the only one. Maybe there were a couple of attempts more, but they were not very succeeding. It is the only one example of fully compatible TMS EEG amplifiers. And here you can see a TMS evoked potential virtually devoid of artifact. So you can really record the first components of the EEG response to TMS after the TMS pulse. Now on the market, one of the most diffused EEG, TMS-compatible EEG amplifiers are amplifiers where they have a wide dynamic range that does not allow the amplifier to go to and saturate, and I will call this system a brain amp-like amplifier because this is the company who sells most of the amplifiers that are used in TMS EEG labs. In this case, you see the artifacts which last for a few milliseconds, and then you can record quite safely the response of the EEG response to TMS. So first, if you want to set up a TMS EEG lab, you need a TMS-compatible EEG amplifier. This can sound trivial, but it is not at all like that. Second, besides a compatible EEG amplifier, you need to navigate your TMS. In order, again, to go back to the paper by Krakow et al., in order to look for the response and maximize the impact of the TMS coil on the cortex. So you need first a structural neuronavigation. Based on a structural MRI of the subject, you can navigate the cortex, choose the right stimulation parameters, keep them constant, because we know from the literature that it's enough to rotate a bit the electric field induced on the cortex to get a completely different waveform of the TMS evoked potential. So this will help in giving you a high degree of reproducibility across sessions, but also so the structural neuronavigation system is granting a high level of reproducibility across sessions, but also will help you in avoiding, especially if you are working with brain lesions, in avoiding pieces of cortex that are now necrotic after, for instance, an ischemic event. Third point, which usually is disregarded in the literature, is the need for a functional neuronavigation. With functional neuronavigation, I mean that during the experiment, in real time, you have to be in full control of what you are doing. Again, this comes from an old paper on TMS-EEG from Paus et al., Journal of Neurophysiology 2001, where they were using a graphic user interface provided with the Nextim system. And I've been working with an equipment very similar to this one. So in real time, you know where you are evoking the larger responses to TMS. In other words, here you have an all channels display from our lab. Here we were stimulating the occipital cortex. And if you zoom in by means of the graphic user interface, you can see, you can be aware whether you are generating a genuine cortical response to TMS. How do I know this? We know that because, first, the very early components of the TMS evoked potential must be larger under the coil or in the proximity of the coil. Here you have the 4 channels around the coil, and you have the larger component, early components compared to what is recorded from the other channels. Second, and again, this is trivial, but is based on neurophysiologic considerations. So the first neurons that will respond to the TMS must be under the coil. So if I compare the amplitude of the early components here from these electrodes, and I compare them with the components evoked on the contralateral side, there is a huge difference. So I'm pretty safe in saying that I am stimulating in a specific way this part of the cortex. With the graphic user interface, you can also, and with the new systems like the brain amp-like systems, you have to be aware that there is, again, a huge artifact that can be, just for graphical reasons, removed during the experiments, or you can be aware that you can realize that actually the impedances of some of your electrodes are becoming bad. You should maybe stop the experiments, make the contacts again working, and going on with your experiment. Now, since the brain amp-like amplifiers do not come with a graphic user interface, or let's say they do not come with a suitable graphic user interface, in our lab, thanks to Silvia Casarotto, who is a bioengineer from our lab. We were able to design and craft graphic user interface for this kind of amplifiers, and I strongly advise to go and look for this poster tomorrow afternoon from our lab. So the third component you need to run reliable TMS EEG measurements is a functional neuronavigation system, which allows you to, in real time, online, to control what you are doing and maybe adjust the parameters of the stimulation in order to get clean and reliable TMS evoked potential. Fourth point, which was already part of the presentations from the speakers that preceded me, is the control for confounding factor. Here you have a typical auditory evoked potential triggered by the TMS click alone. And again, thanks to the graphic user interface, you can see whether it is really an auditory evoked potential, because it will have a typical topography with a response on the central electrodes here on the vertex and on the temporal electrodes here, with the specific latencies. We are also trying to improve this procedure to abolish, or let's say reduce, the impact of the TMS click on the response, on the EEG response to TMS, by designing this tool. Is a specific tool that captures the waveform of the click of the coil you have in the lab. It generates a waveform which will be played by earplugs, and then this will be run as a continuous noise that interfere with the perception of the coil click. And I have to say that, at least in our experience, this works quite well. If you do not use noise masking, you can have this paradoxical condition in which you have a flat line while you are using the noise masking in these patients where half of the brain was severely damaged, or you can get a response which is an auditory evoked potential, where you do, in the case you do not use the noise masking. Another point is that thanks to the graphic user interface online, you can be aware whether you are evoking a muscle artifact, and in this case, again, you can have paradoxical results. Here you have an apallic patient where the cortex was basically all dead. There was no significant metabolic activity in the cortex, but you still record a TMS evoked potential, which is not putatively due to the excitation of the cortex. There is no cortex anymore, but is due to the activation, direct or indirect, of scalp muscles. And again, thanks to the graphic user interface and the online control of your experiment, you can adjust the coil position or the intensity or the coil orientation in order to reduce or abolish the muscle artifact, even on very lateral aspects of the scalp. All this was, again, coming out after the paper from the group of Artvi Ziegner, and I have to say that I fully agree when he says that most of the literature, TMS EEG literature, is presenting results which are affected by spurious effects of TMS on the brain, auditory evoked potential or peripheral evoked potentials. And this is due, and we are now aware about that, this is due to the fact that we strongly need to standardize the procedures, the experimental procedures, to improve them and make them available to as many labs as possible. Actually, we are trying to understand in what range we can, to what extent we can compare real responses to TMS to EEG response to real TMS to EEG responses to sham TMS. I have to say, and this is another piece of the story, and we actually already discussed this with Artvig, that it is very difficult for technical reasons to build up a perfect sham. So we are now trying to collaborate in order to add this piece to the story you have seen till now. So to sum up till now, in order to perform reliable TMS EEG measurements, you must develop, apply, and share proper experimental procedures to make sure that you are evoking genuine cortical responses to TMS. If you do that, you can, for instance, explore the cortex and see how different areas of the cortex, like occipital, parietal, frontal areas, are differentiated in terms of the electrical response to TMS, either in time or in space. Here you can see very well how the scalp topography of the EEG potentials evoked by TMS are different up to 200 milliseconds, 250 milliseconds if you stimulate the premotor cortex, here the motor cortex, here the parietal cortex, here, and the occipital cortex at bottom. How can... okay. Then you can measure in terms of amplitude of the TMS evoked potential, how the excitability changes, for instance, when you apply a nodal TDCS to a given spot of the cortex, or when in Parkinson disease patients you administrate levodopa. And you can, of course, measure TMS evoked potential, and you can be quite confident about what you are recording if you apply these procedures in different brain states, like non-REM sleep, anesthesia, or in disorders of consciousness due to severe brain lesions. You can also measure quantitatively the complexity of the response of the brain to TMS, and maybe foster a new way to stratify patients with disorders of consciousness, like in this case, based on the high or low level of complexity of the responses of the brain of these patients to TMS, and hopefully follow up the brain plasticity and the brain response to TMS while the patient is recovering consciousness during his or her clinical evolution.